More than 37,000 children across Nevada have contracted the coronavirus. To give you a perspective, that's like filling up T-Mobile Arena twice. Most children recover and are just fine, but there are hundreds that have ended up in the hospital, just like 9-year-old Harli Hecht. Months later, her battle is far from over.
I'm not doing great.
How did you feel today?
I felt okay, but it didn't feel really good.
Every day, a new struggle.
How have you been feeling since COVID-19?
I've been feeling bad.
Every day's kind of a fight with Harli to, get her through it to the next day. Harli's been a fighter since the day she was born.
Harli Hecht just turned 9 years old. Ever since she contracted COVID-19, her lungs functioned like someone in their 60s. Harli also developed the rare condition tied to COVID in children called multi-system inflammatory syndrome, or MISC.
She was a very active child, singing, dancing. She did cheerleading during PE at school. It was hard to get her to sit down. Now, Harli basically sits, lays down, sleeps. Today is full lockdown quarantine, day 4. Harli, awaiting results, sick as a dog.
In June, the virus spread through their household of 7. Mom, Brandy, started documenting, all to update loved ones from quarantine. Her grandfather ended up in the hospital. COVID-19 already took her grandmother earlier that year.
Harli is now on breathing treatments. It's basically epinephrine.
Unlike the other siblings, Harli kept getting worse. Before COVID-19, Harli was diagnosed with vascular Ehlers-Danlos syndrome, a tissue disorder, and Chiari malformation type 1, which affects the brain at the spinal canal. Besides occasional headaches, Harli was a happy, normal girl. Now, she had trouble breathing.
And I had to take Harli to the emergency room because her oxygen was in the low 80s. And then her pediatrician just kept treating my kids with, antibiotic shots and steroid shots. Until we started to get better. Harli didn't get better.
I'm sorry you don't feel good. It's gonna be okay. We're gonna get better.
Other strange symptoms wouldn't go away. The headaches became unbearable. They progressed into seizures. Then, the stomach pain and bizarre swelling.
And then we finally saw the gastrointestinal doctor who said she has Miss C.
The Centers for Disease Control and Prevention have documented more than 2,000 cases of MISC in children, most between 5 to 9 years old. An overactivated immune system inflames blood vessels in the body. Children suffer fatigue, rashes, stomach pain, swelling, and respiratory symptoms.
She basically went from living, having a life, to now she's surviving and trying to get to the next day. And then 7 months later, she's still dealing with the drops of oxygen and still taking breathing treatment. So we were sent to Dr. Nakamura.
This room is like the Hulk room. We just have a lot of different Hulk pictures in here, and we have the Golden Knights room where we have a lot of Golden Knights things.
Dr. Craig Nakamura is a pediatric pulmonologist, assistant professor at UNLV School of Medicine, and advisor to students at Touro University.
In Nevada, there's about 700,000 children, and so if you look at out of the 700,000 children, 37,000 cases of coronavirus. The best way of explaining it is like if you take T-Mobile Center, fill it up with kids 2 times. You don't hear about kids as much just because they sometimes have milder symptoms and they have a much lower death rate, but it can still really affect them. So,
since the pandemic, Dr. Nakamura has treated dozens of children with COVID-19. Some need rehab. A handful need oxygen at home, and that includes Harli. This is her CAT scan.
So this is leftover from the coronavirus, COVID. And so typically you would expect this to go away at a few months.
While kids can run and play, children like Harli get winded and tired.
So you're looking like 55, 60-year-old with asthma.
How many of these patients had pre-existing conditions or were kids that were completely healthy?
We are seeing kids at higher risk, but there are also very previously healthy kids who are in the hospital on the ventilator or in the ICU.
Dr. Nakamura says, unlike adults, children recover much faster. their brain helps their bodies regenerate, so there's plenty of hope. What's the future for these children? Are they ever going to be normal again?
That I do not know. I mean, we expect the majority of them, meaning 9 out of 10, get back to normal, but there's a small percentage that I'm not quite sure they're ever going to be normal again.
I worry about other families. I worry about other kids. She suffers a lot, more than any child ever should. But no matter what, she has that smile on her face at the end of the day. And all she wants is for other kids to not be sick like her.
Why is it important to you that other kids don't get sick?
If they get sick, then they won't be able to do the things that kids always do.
Harli is a brave and very strong young lady. So Harli's seizures have now become so severe, she's going to have brain surgery later this month. Her mom says the seizures started and progressed to this point only after, John, she contracted COVID-19.
Well, we hope all the best for Harli, but is there a message for parents here?
Yeah, a lot of parents might see this and be really concerned. Well, Dr. Nakamura says, keep in mind, this is rare. This is rare that this happens to children, but it does happen. And ultimately, what parents need to take away is why hand washing, mask wearing, social distancing, sanitizing is so important for kids to practice. And ultimately, parents should make sure that their kids get the vaccine when it's finally available to children. John.